Now, in any first aid book, on our videos and our training courses, we always talk about putting gloves on. It's so important to perform a barrier between you and the patient against bodily fluids. One thing on training courses, when you have face-to-face courses, often people say is, well, I might not have gloves with me. So what we're going to do in this video is have a look at some other things you can use if you haven't got gloves. Now, first I need to say, gloves are going to be the best because they will cover all of your fingers, they're good tight fit, they're strong. These things like nitrile vinyl gloves, vinyl aren't quite so strong, but the nitrile one's much better. So if you've got proper gloves, we'd always say use them because also you've got good movement in your hands. There's some other common things you could use if you haven't got that. You may be out walking your dog or even just a dog owner. I think most dog owners have always got a dog poo bag with them. Now, first thing with it, it's very thin, so you've got to bear that in mind. But if you think about what you actually do with this, and you know it is strong enough to avoid any problems when you're picking up your dog's poo. So dealing with the blood, you could just literally put this onto your hand and you can use that. So if you had to have a barrier that put direct pressure onto a wound, something like a bag like this would be absolutely fine. When you're done with it, make sure you remove it carefully. But the good thing about these is you've got the handles at the top. So you can just pinch the end of the glove, the poo bag, and literally turn the whole thing inside out, and then you can dispose of it. So it would work very similar to a normal glove. Other things could just be a plastic bag, sandwich bag. This is a little Ziploc bag. You can put it in. Downside of these is obviously it's a bit more restrictive, but again, if you need to put your direct pressure onto someone, it's ideal. Just try and make sure obviously you're not going to get blood dripping in at this end, and again you can just pinch the end of it, hold it in tight and literally just crunch the whole thing off and finally just take it off this way, and all the blood and the nasties are inside. And you can also, like you would with gloves, pick up any dressings or anything like that you've got there. But remember, it's now inside out, so that the zip seal won't seal at the top, but at least when you're disposing of that, all the bits and pieces are there. Now you could use pretty much anything. This is an old coffee packet, something like that. Now, if you haven't got these to hand, they might be about. So it might be you're dealing with a first aid stabbing or something horrible that's happened in a park. And maybe there's a crisp packet there or a piece of plastic or something like that. These are the sorts of things you could use in order to provide a barrier between you and the patient's bodily fluids.